This is an article that came out on the Fix December 21st, 2017, and I will leave the link to this article in the description box. Why the opioid plague affects women more than men. Opioid overdose death rates have increased 400% among women in recent years compared to 265% rise among men. Opioid overdose rates have risen much faster among women than men, underscoring gender-based disparities in health and unequal access to care that can leave American women vulnerable. Ooh, isn't that one of Trump's hate words? I believe so. That outsized impact of opioids on women signals a much higher problem for poor health and poor access to care that make women more susceptible to addiction and once addicted, more likely to die as a result. I'm not surprised about that. All right, so it has increased 400% among women in recent years compared to 265% among men. And they found the disparity between overdose rates among men and women was the greatest in states that had the highest rates of opioid prescribing. For example, Alabama had the largest disparity between health outcomes for men and women, and it was also the state with the highest rate of opioid prescriptions, with 125 opioid prescriptions written for every 100 residents in 2015. Damn. The correlation is most striking, even examining both the overall population and whites specifically, the group hit hardest by the opioid crisis. So, women's health issues often contribute to poorer outcomes for children and families. The rising rate of infants born dependent on opioids is one way that gender disparities around addiction are affecting the next generation. A trend that will exact a price in the form of higher medical costs and social burdens for decades to come. And they said these opioid addicted babies actually spend more time in the hospital than any other baby that has an addiction, like any different type of addiction. And they're the most expensive to treat. The last time I read, it was like $75,000 just to treat one baby with an opioid addiction. That's a lot of damn money. Okay, women often receive opioid dose that's too high, given that they generally have lower body weights. They are also likely to be given longer lasting doses of opioids, which increase the risk of becoming addicted. Because women experience certain diseases like diabetes, heart problems, and mental health issues at higher rates than men, doctors must be able to treat them effectively. The best remedy for women is also the most difficult to achieve. We must improve the overall quality of healthcare in states where the disparities are greatest, which are also the places where overall health quality is poorest for both sexes. So, the long term consequences of ignoring the gender gap in healthcare should frighten us more than political tempests, he said. You know, I'm not surprised. I'm really not surprised at all. Um, and a lot of these babies, from what I'm understanding, are being abandoned around the country. So, that's also a rising issue because of the drug addiction. And, like I said, it has that domino effect that we all know, especially if you've been following my videos all the way up until now. I'm just not surprised. But it just goes to show you how bad things really are in this country. It is exceptionally bad. with all of the deaths that are going on and the numbers being underreported by the CDC, and only 22 states have reported numbers out of all 50. So you're never going to really get to the truth about this addiction. I think if we had the real numbers, I really truly believe it would be soaring way past 100,000 deaths per year. No doubt. Please tell me what you think, ladies and gentlemen. And don't forget to hit on that notification bell. And, in my next few videos, I'm going to also remind you to check out my channel on Black Junction. Please become a subscriber, watch the videos, and like the videos. Peace, family.